Hi, welcome to Medical Monks, where your care is our highest calling. My name is Nikki, and today we're taking a look at a product from Molnlycke called Mepitel One. Mepitel One is a skin barrier that is designed specifically to address the concern of skin tears, along with some other kinds of wounds, but we're going to focus today on the skin tears. This is an issue that afflicts an awful lot of people who already have delicate skin. We aren't talking about an abrasion, we're not talking about cuts or burns. We're talking about a population that has delicate skin that will actually pull and tear away from itself. So we're talking about babies because they have thin and delicate skin. They have a lot of things in their structure that isn't quite developed yet. And we're talking about older folks who have had some things in their skin change over the years that make them more susceptible to this kind of an injury. So what are some of those factors? Well, as we age, we tend to lose collagen, which I'm sure everybody has heard of. It's one of those beauty catchwords, but what it does is something very specific and important to our skin, which is actually the largest organ on the body and designed to keep out all kinds of things, right? Collagen is the thing that makes our skin elastic and lets us bend and flex, and when that's gone, we have something that's a little bit more brittle left in its place. The other kinds of factors that are involved in that are the reduction in the production of sebaceous glands or oil and sweat glands, which just means simply our skin is drier as we age. The third thing is the fact that our dermis and our epidermis, so those two layers of skin, they tend to kind of adhere to each other like this. And I think of it as if you had to package anything that is delicate and ship it, egg crate foam. Think of them like those little mounds, and they have places to adhere to. As we get older, that tends to flatten out, which means you have the potential for shearing. So it's just actually makes one surface slide more easily over the other surface. So what is the danger of a skin tear? Besides being very painful, it just leaves an open wound for the potential to have proliferation of all kinds of microbes and other things in there that can become something much harder to control. The goal, obviously, is prevention. So good care, moisturization, knowing what to look for. A lot of these kinds of injuries actually occur because of an outside force, something mechanical, like moving a patient in a care setting, or exposure and being bumped up by wheelchairs or walkers, bed rails. Those kinds of things tend to be the most common reasons for this particular injury. So let's say we've done everything we could to prevent this injury, but now we actually have this injury, and so we're going to treat it, and that's where Mepitel One comes in. So I have a fellow here who's not doing so hot. For our purposes in demonstrating, we're going to look at this particular spot. We'll call that our tear. The way to think of a tear is like an overly ripe peach. If you ever picked one up in the middle of the summer and your thumb has just pulled that skin down a little bit, ow. So that's what we're looking at. There are three kinds of those, and they are just like a burn: first degree, second degree, and third degree. The first one we're talking about really, and we're addressing with this product, is with a full intact skin flap, which actually acts as its own primary dressing. So we're talking about a little bit of a tear where the skin is still healthy and viable, and it's going to be pulled up a little bit to cover that wound. How are we going to treat a skin tear? There are a couple of steps. The first is to stop the bleeding, and you would want to use a gauze pad that is non-woven, something that doesn't have anything that would possibly potentially stick. We're really trying to make sure that we maintain the integrity of that skin and that skin flap especially. That's going to give us the best chance for healing. The second thing we're going to do is elevate that a little bit if we can, and we're going to rinse with either a tap water or a sterile solution if that's handy. If you're in a care setting, that's likely what will be available, and elevate a little bit. The third step would be to actually apply that skin barrier. So let's take a look at what Mepitel One looks like and what it does. Mepitel One comes in a variety of different sizes. Some are going to address things as even as large as skin graft sites. That's pretty big. We're not talking about those kinds of wounds today particularly, but that's available. And it's already prepackaged in something that is sterile because we're trying to keep all those microbes out of your wound. What are some of the features and benefits of Mepitel One that make this ideal for this particular kind of wound? Well, for one, it's transparent. This is really important to a clinician so they can actually see the progress of healing of a wound. And also because we're going to leave that wound as best as we can undisturbed up to 7 to 14 days if all is going well, because the name of the game is don't disturb the skin. So that's what is really special about this, is that you can actually see that wound. The second thing is you can see the perforations. There's tiny little holes there for breathability. That's important. Also, it'll allow exudate to come out through there if that's something that's happening in this wound, in which case you're going to want a secondary dressing, and that's where we would probably use our Mepilex with our foam and our border on there for extra absorbency. The other thing that makes this unique is the adhesion, something called SafeTac. So it's super sturdy, but we don't want to cause further injury to the skin by pulling something off and ripping further. So SafeTac is something that is actually going to help make sure that it stays in place for up to those 14 days, and also is going to be very easily removed. Also, it's waterproof, it's showerproof. So while air is getting out, moisture is not coming back in. So those are all things we really want for our wounds to heal in the most ideal setting possible. So our guy has a tear here that is actually a skin flap. We're going to, for our purposes, imagine going in this direction. So we've already probably pre-moistened if we needed to with a little saline, and we've stretched that flap over a little bit. We've got markers on here, 1 and 2, and I'm going to start on the side and pull in the same direction as the actual tear itself. And you can see I don't even have to touch this wound. I'm pulling it across this way and helping to smooth and flatten as we go. And I've misjudged my target just a little bit. Now, clinicians suggest actually marking which direction your wound is going in, so you know which direction to remove this, so we are not disturbing that flap. If you pull it back this way, you're going to start this process all over again. That's costly and painful. What we're going to do after that is put on a tubular gauze bandage that will act as an anchor. It'll also keep that clean. And protect that. Now let's suppose that our patient actually has some exudation coming through here, and we need something a little bit more hardy. We have Mepilex foam. It's bordered and there's a foam pad under there. Similar packaging, similar strategy. We're going to start in the direction of the wound and right over top of our wound. Also breathable. And then we can roll back down our secure dressing. Thanks for joining us. I hope that was helpful and informative to you. If you liked what you saw, please be sure to like and subscribe for more content and more really great products. Thanks so much.